This is our value proposition on type 1 collagen hydrogel tape for bone fractures. I'm Anna.
I'm Aidan.
I'm Lily.
I'm also Aidan.
Okay, so a little background. A fracture is a partial or complete break in a bone. The image in the top right are different types of bone fractures. About 6.8 million fractures occur every year in the US. Fractures can be caused by traumatic injuries, diseases, or high impact activities. Recovery generally takes about 6 to 8 weeks. And anybody can experience a fracture, especially older populations, because the bone density generally tends to decrease after the age of 50. The gold standard treatment is an open reduction internal fixation procedure to align the patient's bone, and that includes adding metal rods, screws, plates, pins into the injured site, and that is the image over here on the right. But issues with this include corrosion, undesired tissue interactions, and toxicity. So the clinical need would be to create a biocompatible fracture treatment that preserves biofunctionality, shortens recovery times, minimizes corrosion, prevents undesirable tissue interactions, and eliminates toxicity concerns.
So what is our device made out of, right? So we have 4 main ingredients. We have collagen, hyaluronic acid, I hope I'm pronouncing that right, hydroxyapatite, and osteoblast adhesion peptides. Next slide. So the first step in creating the backbone of this bandage / wrap will be to cross-link collagen into a membrane. This can be done most likely via UV cross-linking. And the cool thing about this is that we can actually control the degradation rates of the collagen via the degree of cross-linking. So we can personalize it to whatever the fracture site is, the degree of fracturing. Next, we have the next step that'll go on top of this cross-linked collagen membrane is a hyaluronic acid and hydroxyapatite hydrogel with a peptide coating. The peptide coating can also be interchanged depending on the patient, what their needs are. And hydroxyapatite hydrogel is made, once again, can be made from UV cross-linking. For this, we'll probably use chemical cross-linking as described in papers from our research. But the way that we're doing this is we need these cell adhesion peptides to ensure that our actual wrap is sticking to the bone, to ensure that there's actual transfer of nutrients from the actual, both the backbone wrap and the hydrogel itself through. None of this will happen if none of our cells adhere and none of the osteoblasts adhere to our surface. And next is implant in the patient. So the way that this is going to work is essentially the surgeon will receive a wrap, they'll wrap it around the bone, they'll cut it to the exact length they need. Generally, 1 wrap around the bone is sufficient. And then from there, they'll surgically suture the ends of the wrap together using biodegradable sutures. These can be made out of collagen, fibrin. There's a bunch of different options on the market. Yeah.
So overall, we chose to use collagen type 1 because it's biocompatible, osteoconductive, and biodegradable. We think that our design will provide a less invasive than grafts because it doesn't need to be taken from other sites, and less invasive than bone plates because it doesn't need to be drilled into bone. We think that it'll have better healing to original tissue, and no material will be left inside when it's done, as in bone plates where there could be corrosion. And overall, we think the combination with hydroxyapatite and surface peptides will enhance the healing. And we found that it's very easily isolated from various animal sources, and that the collagen scaffold costs at most 21 cents per centimeter cubed.
And the competition for our design, the first one, the current treatment is open reduction in internal fixation procedure, which uses rods and screws. Downfalls of this is infection, corrosion, and undesired tissue interaction. It's also a very expensive procedure and can cost upwards of $20,000. And the other one is Regenecure's patch, which is made from microporous ammonium methacrylate copolymer type A and a plasticizer. And this targets patients with insufficient bone volume. In the complete healing time when this procedure is done is 28 weeks, but they have done it using a bone graft, which shortens the healing time, but does require an additional surgery. This procedure can run $2,000 to $3,000. And with our treatment, it would be 1 surgery promoting osteogenesis and bone realignment without the use of metal materials. And it would be much more cost effective because the cost of collagen is less.